Surgical treatment of epilepsy is attempted when patients typically fail medications. So you have to fail at least 2 or 3 medications at adequate doses, and drugs that are appropriate for the type of epilepsy we are talking about, which is the seizures that come from certain regions of the brain. And once you've failed a few different medications, then the odds that medications alone will control your seizures become diminishingly small. You can try other medications, and there's a growing list of medications available. However, we know from fairly large trials that have been done both here in the U.S. and in other countries that further trials of medications may not yield results except in a very small percentage of people. So that's typically when we initiate what we call a pre-surgical workup or a series of tests to see if we can identify what part of the brain is causing the seizures and what kind of functions live in that part of the brain functions. And if the two, once we have made the determination as to where the seizures are coming from and what risks we have in terms of causing functional impairment, then there is obviously a risk-benefit ratio that needs to be looked at to see whether it's advantageous to go and take out tissue in that portion of the brain or whether it's too risky to do so. And a good part of the evaluations that we do for pre-surgical evaluation comprises of assessing that risk and benefit. The other factor that needs to be considered is the severity of the epilepsy. So if someone has relatively mild seizures, for instance, seizures coming from very close to your motor circuitry that cause twitching of a corner of your mouth repeatedly every now and then. And sure enough, it's failing medication, but the severity of that epilepsy may not necessarily warrant taking a surgical step if it is going to cause some significant collateral damage. On the other hand, if somebody has very frequent seizures with convulsions or even confusion and disorientation, and the seizures come from a region of the brain where you can take tissue out without causing significant impairment, you would typically pursue the surgical route. So when assessing the risks versus benefit of proceeding to a surgical treatment, one not only has to look at the risk of the procedure itself, but also the risk of not doing surgery.